Hello everyone, welcome back to another session with Meghna. Today we're going to talk about seed therapy and how we can use seeds to assist in healing all ailments, including emotional and mental health. So for today we will talk about how we can keep the kidneys healthy, especially for those who are having problems with diabetes, shrinkage of the kidneys, and any other kidney related problems. So what I usually do, I would apply the kidney beans once a week just to keep the kidneys healthy and working at optimum. Now, if you are diagnosed with a kidney related ailment, please ensure that if you're trying this remedy, you need to consistently do it for 3 to 5 days to see great improvement. No therapy works within 3 to 4 hours. So, as the same with color therapy, all seeds should be left on your hands minimum 4 hours, and I recommend that you sleep with the seeds pasted or taped to your hands, and I will show you how to do this. So very quickly, what seeds do we use for treating the kidney related ailments? Kidney beans. Now, I'm not sure if you get them in your country called kidney beans. They're probably called rajmal in India and other parts of the world, and they may be called other names as well. They look exactly as the shape of a kidney, and you can see that. So what we're going to do today, we are actually going to place 2 kidney beans on the correspondence of our hands. As I've already shared, all treatments in most of my remedies are using the hands as the basis of the correspondence of the organs. So for kidneys, we are actually going to place them on the outer side of the hand, which we would refer to as the young side in some parts of the world, or the outer palm of your hand. So we do treat some ailments on this part of the palm and the hand, and we do treat some on this part, which is the young. So for the kidney, the basis is that we have the kidney situated here, and I will show you how to find it on the correspondence. And you need to place the kidney beans in the manner that I show you. Now, please note, you just need good quality kidney beans, only 2 for the remedy, paper tape, and this is called in different terminology in different parts of the world. Someone was very kind to give me the name of this tape, but that's probably in the country that that person stays, because where I live, we don't call it in any other name, but we just use the word paper tape. So it's generally a porous tape like this. It's not very expensive, neither is the good quality kidney beans. And remember, you are treating serious ailments which cost you more money, even if you went to an Ayurveda or homeopathy or even to a doctor or a specialist. So what we're going to do is to take these 2 beans and we will place it on the tape. But before that, let me show you how to identify the kidney correspondence points. So very gently, remember, we are putting our hand downwards because we believe that in the treatment of any ailments on the hand correspondence, this will be the hands and these 2 are our legs. So we will take the center as directly correspondent to the body. So for example, if we are referring to any parts of excretion, anal issues, rectum issues, it will be here. And if we are talking about the urinary issues relating to the kidney, then we would treat it on the kidney points. So just very quickly, if you place your whichever finger you're comfortable with, and if you're a left-hander, please do it to your right. And if you are a right-hander, please do it to the left, because the kidneys are on either side of your body. However, if we are treating specific organs like the organ of the liver or the stomach, then I would recommend that we use the primary correspondence, because the stomach is on the left of your body, more towards the left, and your liver is on your right. But for kidneys, we have them on either side. So let's stay focused with that part of the correspondence. So very gently, take your finger and you can just go all the way. And as you go up, you can feel it. You can do it a few times. And as you go up, you can feel a dip. There will be a dip, and this is actually your first kidney. Now, when I use the word first kidney, I mean the first kidney we are identifying using this therapy. So there will be a dip and you can feel it will actually go down. Just give it a little massage. And then you take the paper tape, and what you do is place the bean. So the bean is like this. The white should face towards the other side of the other kidney bean. So what are we doing? We are placing the kidney bean similarly to the kidney's positioning in the body. And so please remember, if you're putting it this way, the bean must face the other side, as in the white. Okay? So once again, take it down, come all the way, there is a pit, and please place it here. This is the first tape. And you can just press it down gently and it will stay. I sleep with it overnight and it has no issues. If you have done a fine job pasting it, and that's all right, it will come well with experience. Okay, so we're going to move on to the second, and we're going to do the same thing. So for this, we will take it from the smaller finger, in between the smaller finger and the ring finger, and you take it up, down, and you can, as you go up, you can feel there will be a dip. Now please remember, both kidneys are not lying across each other in the exact position. One kidney will be slightly higher or lower than the other. So don't get worried if your kidney bean looks a little bit disjointed on either side. That's because the kidneys are placed that way. So we're going to do it again, and you can feel it, it's there. So what you will do, you will take the second tape. Remember, the kidney bean must face back to the other kidney bean, correct? Because the white must face each other. So once again, showing you, and what you do, please ensure the white is facing back to each other. And then you take it again, gently go up, and you find it, give it a little press because that's your kidney point, and you leave it there. Now, when we give this as a remedy for many, we always tell them that this particular treatment or remedy protocol, as what we call it, aids greatly even if you are a dialysis patient. Now you have to remember, we respect that you may be skeptical, because when you have a chronic illness, you tend to look at the world differently, and rightfully so, because you're frustrated with the process of having to go for dialysis. But please remember, all chronic issues can be aided and assisted. So if you give this a try, and if you're on dialysis, please do it longer than 3 to 5 days, at least 3 weeks, consistently, daily. Now, I must let you know, maximum can be overnight and minimum is 4 hours a day. So if you prefer to do it in the daytime, please do, but please ensure that this is not left, thrown out or disposed where someone else would touch it, because all seeds have life, which is why they grow into plants and so forth, and so they also absorb energies, and that would happen when it's extracting toxins or anything that it's supposed to actually heal. So please be mindful. Now this video will be a little longer because I'm explaining how we are going to be doing the treatment of seed therapy, but going forward you have the gist of an understanding now, and I will share many more videos on seed therapy which can aid you. I promise you this will help you if you do it consistently. Now the seeds, if you have serious illnesses with the kidneys, the seeds may even show a difference in color in the following mornings, and sometimes the seed may even rupture. So please do not panic. It's just that it is doing its work, and there is no effects of seeds, because remember, we also consume them and they have not done anything to us. So I wish you well. Any queries, please come back to me in whichever way you have found this video, and I'll be happy to clarify any points with you. Thank you for trying the seed therapy for good health of the kidneys. Have a good day.